This is such a huge bit of news that it's hard to know where to start tackling it. We're going to talk about the CASS report, the CASS review by Hillary Cass. Like, it's called that because that's the name of the person who is, like, sort of in charge of this review. And what is it was supposed to be a look at the way that trans healthcare is done for youth on the NHS in, like, the National Healthcare Service. Has, obviously, we know, some problems when it comes to trans related care. Like, there's really long wait lists. If you are a transgender teenager and you get on the wait list, you often are still waiting by the time you turn 18, and then you have to start over and get put on the wait list for the adults. Like, it doesn't carry over. And that's just one of the many problems. Like, okay, well, why is the wait list so long that I was waiting 3 years for my first appointment and I aged out of the youth system? Like, why? Well, because they're not putting very much resources to it. For a very long time, there was literally only one clinic providing this care to teenagers, which was the Tavistock Clinic. You may have heard of it before, with various scandals, like with Kira Bell. So because they can arbitrarily create bureaucratic problems, like, oh, your regular doctor just kind of forgot to send your referral to the gender identity clinic, or the gender identity clinic tells you, okay, well, we'll see you on such and such date, and then your day gets canceled, and then, oh, well, like, when am I going to be seen now? It's just pretty absurd how slow things go over there. And they're just trying to restrict it even more. Like, it's not good enough, apparently, that they recently just declared that trans youth can't get puberty blockers unless they are signed up for, like, a clinical trial. So it's like, okay, you've already basically declared that this healthcare is not accessible to youth because in the UK they don't do cross-sex hormones for teenagers, like, until and unless they've been on puberty blockers for a while, as I understand it. So if you won't give kids puberty pausers, then you also are, like, basically stating that you're not going to give them cross-sex hormones. Yeah, Tavistock had like 70 staff, none of whom are being allowed to be redeployed to the new services. So they're not going to let people who already have experience working with trans youth work at any of the new clinics. But they are supposed to be opening new clinics, hypothetically. Yeah, it takes a year on puberty pausers before they will move them on to cross-sex hormones. Really, they banned puberty blockers for private healthcare too? I didn't think that they had the jurisdiction to do that. Like, that for the NHS to just declare that Gender GP, which is a private clinic not operated by the government, is just, like, not allowed to provide. Yeah, there is some concern that the new clinics that they're going to open up might have, well, because of things like this. So the CASS review is supposed to help inform the NHS on how to proceed with trans care. And the methodology was messed up, and the conclusions that they came to were inaccurate, and the NHS is seeking to use this information to justify continually restricting access to these things for trans youth and for adults. So if part of the review says, like, oh, you should allow people to cut their hair, but you shouldn't allow them to get hormones, like, then functionally the way that the therapists and medical professionals are going to take this is, yeah, so apparently we should do everything we can to make the kid do something else, like basically some form of coercion, or what is generally called conversion therapy. Okay, yeah, so there's an article. We don't need to go in depth about this. Yeah, this is checking with new guidance in the CASS report. Oh yeah, making sure that that's applied by private care providers to prevent private care providers from giving anyone under the age of 18 this care. Great. Okay, so Bella says that the premise for this CASS report was that there was supposed to be an unbiased report into the issues facing trans healthcare for youth right now, with the understanding that the current model wasn't working. And the reason why the current model isn't working is because of those huge wait times. Because on the NHS, you're supposed to be seen by your specialist. You, like, if you get referred to a specialist, you are supposed to be not made to wait more than 4 months for access to that care, or like 16 weeks, something like that. So the NHS is breaking the law by having such long wait times for trans people, and there's just no recourse on that. There are a lot of methodological problems with the CASS review. I don't have a thing pulled up for this exactly, but it has been stated multiple times that the information that they provided were from overwhelmingly like biased anti-trans sources, which tracks. That's what we're doing in the US as well. But so there are enough issues about the methodology of this that professionals in Britain are like, yeah, we are going to submit a commentary to the evidence-based medicine review people because apparently it's considered biased. Like, if you are here watching this and you don't agree with me, and you're going to say something like, well, of course, you're going to cherry pick all the parts that you agree with or you don't agree with, and oh, you're only going to be looking at sources from, you know, other trans people. Like, yeah, I'm going to read this post from Alejandra Caraballo, and like, I'm going to look at posts from other trans people about this. So why is it that it is considered okay for an anti-trans individual to be in charge of this, to use anti-trans sources, and like, that's not a conflict of interest. But if there were any trans people involved, or if there were any pro-trans people involved, that's considered biased suddenly. Like, there were no trans people involved in the creation of the CASS review. Not a single one. If you're enjoying this video, hit the like button, maybe subscribe, hit all notifications if you want. Feel free to check out the links in the description. You might find some merch you like, or you can hit up the Patreon to support the content and find free stuff. Okay, so we have an executive summary here. Yeah, so one of the reasons why the methodology of this was flawed is because they did not admit any double-blind, or sorry, they didn't admit any research that wasn't a double-blind study. So this is like the term high-quality evidence gets thrown out when you're talking about this kind of issue. Like, is it possible to have a double-blind study? Now, usually what happens, like, let's say we're trying to test whether ibuprofen actually works as a pain reliever. You know, we might have a group of people over here who are giving ibuprofen for their headache, and we have a group over here who we are giving a placebo for their headache. Because the placebo effect, if you take a pill and you think it's supposed to give you less of a headache, it can actually do that. Like, it can actually give you a perception of a reduced headache because of the power of the placebo effect. So when you're doing a double-blind study, the purpose of that study is to determine if the actual ibuprofen group, if they had more pain relief than the placebo group. Like, you have to prove that something is more effective than a placebo. And like, it's tough to do a double-blind study on trans people because let's say you have two trans girls, like two teenagers who are trans girls, or even two women who are trans women, and you give one of them estrogen and you give the other one a sugar pill. They will know within the time that the study is being taken whether they are on hormones or not. So it ends the illusion that you could have taken either medicine. Like, the whole point when you use a control group that you give the sugar pill is that neither group knows whether they got the real ibuprofen or whether they got the sugar pill, you know? But because the effects of puberty pausers and cross-sex hormone therapy, they're so obvious that your patient, there is no double blind. You cannot do it. It's not possible. And there's a question of whether that's ethical as well. If you have a teenager who is suicidally dysphoric and you enter them into a double-blind study where they could be receiving puberty pausers or they could be receiving saline, like, is it ethical to put that person in a situation where their health is being put on the line in that way? And that's like referring back to treatment for HIV/AIDS. They tried to do double-blind studies for treating that as well, but those studies largely didn't work because it was obvious if you started to get better or not. And the men, largely men, who received the like pills that were actually helping, they would start to share their pills with the people maybe who were in the study or who weren't in the study, who weren't getting better. Is it even possible to do ethical double-blind research in this way? Yeah, double-blind breast enlargement surgery. You can't double-blind cancer treatment. And so you can't have that standard for all medication. It just doesn't, it literally doesn't work. Yeah, people in the HIV/AIDS studies, they would mix all their doses together to make sure everyone is getting at least some of the real dose. Yeah, I hadn't heard that specifically, but like everybody takes the pills that they were supposed to be taking. They kind of like mix them up and distribute it. So because they're sharing the medicine, those people who are now getting the medicine, you won't be able to see a control placebo effect on them because they're receiving the medicine. But also the people who are supposed to be receiving the actual medicine are not going to be seeing as much improvement in the study because they're receiving less of the medicine because they're sharing it with people. Yeah, the morality of double-blind studies has been called into question pertaining to life-saving drugs because you are having people usually get off the medication. Oh, they are having to get off of other medications that they're already on so that the study is not skewed by the results of people being on different meds. And then the placebo group get put into a state of health decline because of this. And Kitty Tick's mom was almost killed because of being in the placebo group for trying to get life-saving medicine. But they did allow some studies in this review that were not double-blind if they confirmed the view of the person writing the report, which is basically that there shouldn't be trans healthcare. Like, effectively, they'll say, oh, we want to improve this. We want to make sure that the people who are receiving this medicine are really needing to receive it and all this. They have this like paternalistic, oh, we do want you to get the healthcare, but we want to make sure that only the people who really need it are getting it and all this. And it just ends up being like the group of people that they think need it just gets smaller and smaller over time for some reason. It's super weird. One of the screening criteria they used with the study was that the study had to be in English. Yeah. So any non-English speaking countries who have done rigorous studies on this, it's just not being included. The Dutch study was eliminated. Oh, God. So Dr. Hilary Cass is a pediatrician. She's been, she has to do this thing studying what's going on with under 18s, reviewing the efficacy of puberty blockers. Report starts from the conclusion that trans children deserve holistic, timely, and individual health care which meets their needs. It states that while not all trans children will need medical treatment, some will. It claims that the level of research into medical pathways and treatments in this area is very poor and calls for more research. It calls for all people receiving puberty blockers and cross-sex hormones to be entered into a longitudinal study to examine their efficacy. We have so much research on the efficacy of these drugs. Like, in fact, one of the issues that they have in this is, like, they complain about the fact that the overwhelming majority of teenagers that you put on puberty pausers are going on to take cross-sex hormones and continuing to identify as trans. So they're doing this weird, like, oh, well, puberty pausers cause transness or something. Like, no. It means that, like, the process of determining who is trans is so rigorous that you are only allowing in, like, people that you're absolutely sure need it. It's like, okay, we're not unnecessarily giving anyone puberty pausers who doesn't extremely need it, which is, like, a bad thing because it means that there are people who do need it but don't have, like, exactly the right symptoms that you think that they should have who are not getting it. Like, the regret rate should be higher because more people should be able to access this. Like, the bar is way too high. And when they say holistic treatment, it's important to note that they think that there should be screenings for autism and mental health before they'll allow puberty blockers, which is great because like a lot of autistic people, like a lot of trans people are autistic, and like lots of trans people have eating disorders because it's the only way that they can control what their body looks like. So there's this demand that there be increased scrutiny. And keep in mind that for precocious puberty, if you have an 8-year-old little girl who starts her period in the UK, you can go to her regular pediatrician probably. Maybe you might get referred out to endocrinology for that specific issue. But basically, you don't have to have an entire psychiatric assessment in order to get that care if you're cisgender. But if you're trans, well, now you're going to get put on a 5-year wait list. Like, good luck, have fun. So that's the separate but equal thing going on there. And that's one of the reasons why these laws are not working out in the US is because we have the 14th Amendment that says you can't treat people differently under the law based on who they are. So if you allow puberty pausing medication to be given to cisgender people with precocious puberty, then it is not equal protection under the law if you deny trans people because they have a different diagnosis. Yeah, the reason why they test for autism first is because they are paternalistically going, oh, well, you poor little R word, you don't know. Like, you don't know anything about yourself, and therefore you don't get to transition. Like, that's basically how this ends up shaking out. Looking at the outcomes, NHS England acted within 2 hours to remove funding for new prescriptions of puberty blockers to trans children after the initial judgment in Bell versus Tavistock review. When the Tavistock won their appeal, NHS England's decision was not overturned. NHS has barred trans people from being part of the CASS review core team, while advocates of conversion practices were allowed to be part of the core team. This is what I'm saying. It's considered acceptable for explicitly anti-trans people to be in charge of determining and studying whether trans people get access to care, but trans people are not allowed to be part of the decision-making process. On 12 March, NHS announced an effective ban on all puberty blockers for trans children, unless they were in a clinical study, yes, which obviously has raised the question about why the report is necessary, since you've already made it basically illegal, even on private healthcare, remember, for trans youth to be on puberty-pausing medication. It's also failed to recruit the necessary staff for the 2 gender identity clinics for young people after Tavistock has been closed. The waiting list for young people's gender services is currently estimated to be between 3 and 4 years. So if you're 12, you might be on puberty blockers before you turn 18. Maybe. Yeah, literally advocates for conversion therapy. That's who we're going to have. Shortly after the CASS report was published, NHS announced that it was bringing forward the review of the service specification for adult services by a year and initiating a review of adult clinics. Yeah, I had this open over here. Like, adult trans clinics in England are going to be facing a CASS-style inquiry into how they treat patients after whistleblowers raised concerns about the care they provide. NHS England has announced that it is setting up a review of how the 7 specialist services operate and deliver care after past and present staff shared misgivings privately during a previous investigation. As a first step, NHS England will send, quote, external quality improvement experts into each of the clinics to gather evidence about how they care for patients to help guide the inquiry's direction. So that kind of means that your medical records, like, more people's medical records are going to be opened and added to, like, a database to review. Like, they might anonymize it. Oh my god, I cannot speak words. They might make it anonymous to a certain extent. But this is, like, pretty scary for a lot of people, thinking like, okay, I guess I have to start stockpiling my medicine now. Like, what happens to these people who have been on healthcare for a long time and they're going to just be, like, denied access? Or what is the deal? And again, no trans people are ever consulted about this. So whenever there are recommendations for changes, it's always like, oh, there needs to be more gatekeeping. Oh my god, there's too many trans people. Oh my god, there's too many detransitioners. While not a single trans, or mostly, like, not asking detrans people either. Like, only asking the certain detrans people who are willing to be anti-trans. Why is it that I never see detransitioners who are pro-trans being interviewed on Fox News? It's because they don't serve the narrative. Because there are detrans people who are just like, yeah, it didn't work out for me. I didn't end up being trans in a permanent long-term way. Or maybe I just wasn't binary trans. Like, it doesn't serve the narrative. Is there racism in the NHS? Let's check in with a bunch of white people, no people of color whatsoever, and also Carl Benjamin. Yeah, this is what's been going on in the UK. Yeah, there's a lot of panic in people, like trans people in the UK now, talking about, like, stockpiling, talking about alternative means, like, how are you going to afford to go to the gender GP? Or, you know, for trans girls getting access to estrogen online, it's kind of a gray market. So you can do that and it's not explicitly illegal. But for trans men, if they need access to testosterone therapy, like, it's not easy to, like, it's a very serious crime to purchase testosterone, like, outside of the context of getting a legal prescription for it. So that's half the trans population. If they get like all of the healthcare paused, those people are not going to be able to easily get alternate care, at least not without taking on serious risk. Okay, let me go back to this review thing. It was also been announced on the NHS that they're appointing Sir Simon Wesley to head up a new research oversight board. Wesley concentrates on psychosocial models for poorly understood conditions, such as ME, CFS, and Gulf War syndrome. The concern is that he would view trans people in the same light, namely that being trans is not a, quote, real condition or does not need medication, and will therefore disregard any evidence that counters this view. Yeah, so, you're working on a psychosocial model for MECFS for chronic fatigue syndrome. You think that it's a psychosocial phenomenon for people to not be able to even look at their phone while they're laying in bed because the light from their phone will give them a headache and reading will make them feel exhausted and like not able to eat later that day. Like a psychosocial model for MECFS. Cool. This guy is the perfect person to put in charge of a situation where, like, yeah, a lot of people think that being trans is not a quote real condition. CASS states that the aim of the review is to ensure that children and young people who are questioning their gender identity or experiencing dysphoria receive a high standard of care that meets their needs, is safe, holistic, and effective. This word holistic is a red flag. Okay, what are there some good things in this? Report states that generalizations about children and young people questioning their gender are unhelpful because people are individuals. It also states there should be no hierarchy of gender identity or how this is expressed socially or medically. Nobody should feel the need to invalidate their own experience for fear that it reflects badly on other identities and choices. Okay, that's a good statement. For some, the best outcome will be transition, whereas others may resolve their distress in other ways. Some may transition and then or retransition or experience regret. The NHS needs to care for all those seeking support. Okay, so ostensibly, it would be a good thing for them to support detransitioners because unfortunately, a lot of the time, detransitioners have a hard time getting their healthcare covered. You know, like gender dysphoria is considered, at least in the US, like some insurances will cover it. But a lot of the time, like a detransition, it's like not going to be covered in the same way. So it's, you know, what are you supposed to do if you can't afford it? Yeah, hysteria, true. Yeah, I do feel that this is all window dressing. This is all lip service. This is the pretty words, and the stick is just waiting. The stick is just waiting. Yeah, it claims that the evidence base, particularly in relation to puberty blockers and hormones, have been shown to be weak. I don't think so. The University of York was commissioned to undertake an evidence review. Let's see. So Tilly Langton, who was engaged to design the review's methodology, was part of a group which promoted, quote, gender exploratory therapy, together with anti-trans groups along pro-trans groups when training NHS staff. So yeah, gender exploratory therapy, it like holds trans identities in suspicion, meaning like, we're gonna assume that there's literally any other thing besides you just being trans that is causing you to feel this way. Gender exploratory therapy asks questions like, what kind of relationships did you have with both of your parents? Was your dad a good masculine role model? Like, was your dad around when you were a kid? Have you ever been sexually abused? Do you have an eating disorder or autism that might be causing you to delusionally think you might be trans, but really you're not, and paternalistically we're going to prevent you from getting the healthcare you want? Yeah, it is a nightmare therapy style. It's crazy. My dad left to get milk. Yeah, so gender exploratory therapy basically seeks to put off a transition for as long as possible. And the reason why they do that is because they assume, this person will grow out of it, whatever, they'll just normalize, or they'll progress so far in puberty that they feel like they can never look as they want to, so therefore they won't even bother. Like, the purpose of watch and wait or watchful waiting technique, the assumption that you will desist. Like, they will be able to subtly pressure you over time into desisting. Like, they'll convince you through the therapy that, are you sure you really identify as a man, or do you just not like being groped on public transit? Like, plenty of women, basically all of them, don't like being groped on public transit, but most of them are not going out there taking testosterone to grow a mustache about it. Okay, let's see what else there is in here. CASS report reveals that it disregarded huge amounts of medical evidence, both from the UK and around the world. Out of 102 studies into puberty blockers and hormones, only 2 ended up being included by the CASS review. The report also criticizes the quality of evidence, which we've talked about. No international evidence was considered good enough. Yeah, this is based on not blinding. We talked about double-blind studies. In 2022, the world... Oh my god, what is it called? Oh man. WPATH. I can't remember what it stands for. It's something about transgender health, though. Something Organization for Transgender Health. They rejected criticism around the lack of evidence surrounding puberty blockers, stating that most of the evidence included the effects of other medication and interventions, and that this was appropriate, and found that puberty pausers did have a beneficial effect for trans young people. This was all ignored by the review team and NHS England. The report includes a graph of the number of referrals to the gender identity clinic between 2003, and 2015, the graph ends with a steep slope upwards. The number of referrals to GIDS is known until 2020. So the question arises, why has only that part of the graph been selected? Oh yeah, like we looked at this recently. So they only showed information from 2023 to 2015. They left out 5 years of data so that they could show a sharp uptick. But guess what? We've already seen this balancing out. There was a sharp uptick because there was a sharp uptick in social acceptance. And then guess what is starting to happen now? Just like the chart of left-handedness, it turns out when you stop beating left-handedness out of children, they start using their left hand. And then it's like, oh my God, there's so much devil happening. Oh my God, there's such a sharp increase. And then it levels out. And then like, look at that. Approximately 10% of human beings are left-handed. And it stabilizes. So that same thing is happening with trans health. But of course, they did not show the referrals in recent years because that does not serve their narrative that this is, oh my God, it's a social contagion, sharp increase. Yeah, and just a reminder that these two studies that they did, they included 2 studies and those were not double-blinded either. The hypocrisy is so real. I don't think WPATH is the Pediatric Association because they talk about adult healthcare. I don't think it is. Anyway. World Professional Association. That's what it is. Okay. Yeah. The full graph shows that the number of referrals stops increasing, quote, exponentially. And the last 3 years for which data is available, the number of referrals has plateaued. But that doesn't serve your narrative, does it? See? There was an increase for over the span of 5 years. There was an increase. And then look at that. Since 2018, it's basically been the same. Strange. Report states that, quote, young people are on a developmental trajectory that continues to their mid-20s. Allied with the recommendation that children's services should continue for those up to the age of 25, this implies that people are insufficiently able to make key decisions until they are 25. So are they really suggesting that, like what, are you gonna see an adult services doctor for everything else? But then if you need trans care let's say you're 21 years of age, are you really going to get put on the children's waiting list? Are you sure about that? Yeah, let's just choose an age at which to screw over trans people. You're literally, yeah, we will recruit you to the military at age 17 or 18, but we're going to send you to the children's clinic up until age 25. Oh, a wraparound service for age 18 to 25, but still infantilizing adults for 7 years of their life. In the background of the report, it asserts, quote, for many centuries, transgender people have been predominantly trans females, commonly presenting in adulthood, but no evidence is supplied to support this assertion because that evidence does not exist. Key to the report is a series of recommendations. However, there's very little evidence to show that any of these recommendations will be effective. Given that this is a report which places so much importance on the need for evidence, this lack of evidence is notable. That, the most recent Guardian article I saw when I typed up, Guardian article, CASS review, was finally, now evidence and not feelings are going to be used to determine who gets trans healthcare. Oh yeah? Are you sure about that? They don't actually care about evidence. None of these people actually care about evidence. What they care about is advancing their agenda, and they will co-opt your values of evidence and free speech and, quality care. They will co-opt your values in order to inflict genocidal conditions on trans people. They do not believe the things that they say. When they say, oh, some trans youth might need access to medical care, and we want to make sure they have access to good medical care. They are lying. They do not believe that. Okay, let's see. So there's ethical issues. Some adult clinics have expressed ethical concerns over the need to provide all records for those aged 25 and under to see if there are any matches on this NHS report thing. The report's recommendation is to ignore those concerns and request the DHSC mandates the adult clinics compliance. So adult clinics basically they're going to be forced to divulge their medical information to determine whether, to be part of this study, basically. Yeah, Helen Joyce saying, there is no such thing as a, or even a happy, well-adjusted trans person is a problem for a sane world. Very much Helen Joyce vibes. The report recommends that every young trans person can only access puberty blockers or cross-sex hormones if they agree to enter a study. Yep. Okay, so the report contains some internal consistencies. It's either contradicting itself or not holding itself to the same high standards that it's holding others to. In one instance, it states that there are no established definitions for social transition, but then in the next paragraph introduces and fails to define the concepts of, quote, full social transition and partial social transition. Yeah, The resource cited in CASS, which talks about partial versus full transition, uses partial to mean transition in clothing style and hairstyle, but without a change of name or pronoun change. So this is literally just, why can't you just be a feminine man as like a policy position, basically? So this report advocates in some part for like a quote social transition or like a partial transition that involves like literally just changing how you dress and your clothes and not changing anything else about you. So it's like, is it like is it a partial transition if a cisgender woman decides, okay, I've decided that I've previously been a Barbie girl, and I've decided recently that I'm going to become an outdoorsy hiking type, and so she gets a shorter, um, more practical haircut, and she starts dressing in like hiking clothes. Even when she's doing normal stuff, she's no longer wearing lipstick. She's no longer doing any of that stuff. Has that woman just partially transitioned? Like, what? This is tough. It's tough to get through. The report also states that there is a, quote, substantial increase in rates of mental health problems in children and adolescents across the UK over the past decade, but it also wonders why there is a similar escalation of people assigned female at birth with, quote, high levels of neurodiversity and or mental health issues. So it's like, okay, it acknowledges that there has been an overall increase in mental health problems, but it questions why one particular group has had an increase, as though it's probably not all very similar factors. I was preppy, but now I serve more of a goth mommy type look. I am a different gender. Yeah, you've transitioned to a new gender. You've partially transitioned. Report also states that gender incongruence is caused by, quote, a combination of biological, psychological, social, and cultural factors. Yet, despite this complexity, and also that, quote, a formal diagnosis of gender dysphoria is not reliably predictive of whether that young person will have long-standing gender incongruence in the future, it repeatedly implies that diagnostic tests can be developed to determine whether medical intervention will be beneficial or not. Which is, it's so weird, because, like, they complain about, like, oh, these kids might grow out of it in the future, but also, oh no, we're so upset that the majority of people who go on who go on puberty pausers end up going on cross-sex hormones. Like, oh no, it's that nothing you can do is right. Like, nothing you can do is correct. Yeah, me too. My mom partially transitioned when she changed her name. True. Report also states that studies into puberty blockers showed, quote, no changes in gender dysphoria or body satisfaction. That seems like abjectly false. Puberty pausers are unlikely to alleviate gender dysphoria, as they're intended as a pause on puberty, not a correction to puberty. Oh, okay. So the mistake that they make is like, oh, the puberty blockers don't resolve gender dysphoria. Like, yeah, because all you're doing is taking the situation that you're already in and staying in it. Like, okay, it's not getting worse, but it's also not getting better. Report also states that, as a principle, quote, for some, the best outcome will be transition, whereas others may resolve their distress in other ways. However, in the detail of the report, the extension of children's ages to age 25, children's clinics to age 25 is recommended because it would, quote, remove the need for transition at a vulnerable time, which would seem to indicate that no surgeries or medical treatment would be available in those clinics until you're well into adulthood, which is counter to the legal principle of Fraser guidelines. There's no evidence which underpins the claim that those transitioning between ages 18 and 25 suffer any adverse effects, and this proposal falls outside the remit of the CASS review. What's up, Wendrick? Welcome to the website. What hair length constitutes a masculine or feminine hair length? 1 centimeter for men, 10 centimeters max? Where does it start? Where does it end? Yeah, like, genuinely, if a young boy, let's say, is growing his hair out because he's like autistic and hates getting his hair cut, he's not even trans, but is there going to be an investigation opened into that family unit? Like, because there's suspicion that he's social transitioning? Like, I don't understand. CASS report also makes a lot of claims without evidence, stating that clinicians should apply the assessment framework developed by the review team, which should include screening for neurodevelopmental conditions, does not explain why the screening is necessary. Comments and assumptions around autism occur a number of times throughout the report. Again, the central aim is to help young people thrive. For the majority of young people, a medical pathway may not be the best way to achieve this. There is no evidence supplied to support this assertion. Report states that, quote, in the UK and internationally, it is now the norm for many children and young people to present to gender clinics having undergone full or partial social transition. There is no evidence supplied to support this assertion. To note this indicates that such behavior is a concern, despite the years-long waiting list. It's not clear why such behavior could be a concern. Also, Isn't it like a requirement in a lot of places that you have to outwardly be existing as your gender before they will give you healthcare? Like, I think that that is part of the process in the UK. I mean, it definitely is. It was part of the process under WPATH guidelines back in like the 80s that you have to identify, like, you have to be socially transitioned, like living as a woman before they'll give you estrogen. So, like, yeah, if there's a years long waiting list, again, speaking to like full or partial social transition, like, okay, so yeah, while you're forcing these kids to wait for healthcare, their parents are letting them get a different haircut. Their parents are calling them by a new name. The parents are buying them new clothes. Like, they are trying to help the kid as much as they can in the interim, while you, the government, are forcing that kid to go through the body horror of their original puberty. Like, while you're denying them just health care. But yeah, noting that, indicating like it's a concern. It's a concern that they're, oh my God, you've already socially transitioned without permission from a doctor. Like, did you think I needed permission from a doctor to go by a new name? Like, literally, the amount of paternalistic, like, government overreach in this situation is astounding to me as an American. I don't know, is it as astounding for people in the UK? It states that, quote, those who had socially transitioned at an earlier age or prior to being seen in a clinic were more likely to proceed to a medical pathway. What? Oh my God, I'm about to drop some fucking really mean remarks. However, it also states, quote, the current evidence base suggests that children who present with gender incongruence at a young age are most likely to desist before puberty. So that's a contradiction, and no evidence is provided to support either statement. So on the one hand, oh yeah, these ones who are socially transitioning at a younger age are more likely to proceed to the medical pathway. But also, children who present with gender incongruence are gonna desist anyway. Like, no, I don't think so. Yeah, we're talking about the country that colonized Africa, true. Oh my God, let me take some water. Drink some water, y'all. Refuel your throat before we rage more. Yeah, it's just a phase that lasted my entire life, I guess. I don't know what the problem is with things being phases, okay? Like, why do you think it's a bad thing for people to experiment with their gender and then conclude that they are the gender that they were when they were born? Like, what would be wrong with identifying as a trans man for a few years and then identifying as non-binary? Like, what is the problem? Yeah, great choice between a government that absolutely does not care about people or children, or one that wants to control literally every aspect of your medical care. Yeah, true, experimentation with gender leads to femboys, and that makes them scare-roused. Listen, I love being a femboy. It's my favorite. I get to have long, pretty hair and a weird voice that people really don't understand. And I get to wear strappy goth harnesses. Finster for the win. True. Okay. Furthermore, it states that, quote, the exponential change in referrals over a particularly short 5-year time frame is very much faster than would be expected for normal evolution of acceptance of a minority group. There is no evidence quoted which states any expected rate. Yeah, what is the expected rate? And the report does not make any note of the fact that numbers being referred have largely plateaued at around 2,500 a year ever since 2016, 2017. Report states that, quote, some young adults have suggested that taking time to explore options is preferable. It is not clear how many expressed this view, nor how many expressed alternative views. The report consistently implies that there is comparability between these two groups, expressing regrets about treatment received, minimizing the consistent finding in research that this population is smaller than regret rates for many other common medical procedures. Data quoted in the report does reveal the low number of desisters/detransitioners. Yeah, so of the 3,000 patients that they looked at, fewer than 10 detransitioned, and only 2 of them did they speak to figure out why they detransed. Like, ooh, so it also is worth pointing out that the vast majority of patients at this clinic never medically transitioned as minors. So in total, it was 892 patients over a 4-year window. Like, a lot of these people were being seen at the clinic, maybe, but like had not been receiving any medication until they were on the adult stuff. Okay. Report states that, quote, over time, there has been an increasing acceptance that people choose to detransition for many reasons. The term has been rebadged by some as retransitioned. What? There is no evidence to identify who is, quote, rebadging this, as trans people are very clear about the difference between detransition and retransition. Yeah, where are you? What planet are you on that, like, are we rebranding detransition as retransition? Like, no. There's a pretty clear understanding, I think, universally in the community. Anyone who speaks English, like, you transition, the first time. You detransition if you return to identifying as your original gender, or if you just like stop taking your hormones and stuff because of like social issues and like a lack of acceptance. And then retransition is when you go identify as trans again. Like, it's pretty clear. I'm not really covering Poppy Xena stuff anymore. I mean, we talk about it occasionally, like, but I'm not really doing like in-depth coverage anymore. I'm not really trying to drama farm that whole thing. I believe that the video that I made about them was massively scathing, and that I don't think I need to say anything else in order to damage their reputation. Like, I think at this point they're doing more than enough to damage their own reputation, and anyone who is still a fan of theirs or following it, I'm not going to reach them with covering an interview with No Flake. Like, they think that No Flake is a rapist. So, you know, that would not convince anyone who isn't already convinced. Also, penalizing private practices. The NHS Constitution requires that the NHS investigates sourcing alternative private provision if the wait exceeds 18 weeks. There is no evidence that this actually happens in trans-related healthcare. So like I said before, they're meant to be seen in 18 weeks, which is about 4 months. And if you don't have like a quick enough referral, then the NHS is supposed to investigate getting you that care privately, but apparently they don't do that for trans people. Such long waiting lists may be why, quote, it is now the norm for many children and young people to present to gender clinics having undergone full or partial social transition. Yeah, duh. The report recommends that those seeking private practice outside NHS standards should not necessarily be granted access to future NHS-related healthcare, NHS gender-related healthcare. NHS guidance clearly states, quote, you're still entitled to free care if you choose to pay for additional private care. Wow. So the recommendation is a proposal to penalize young children who see private practitioners because of the deficiency in NHS offering. Puberty does not wait, certainly not for a few years, and can cause significant distress to trans young people. So in the US, we have this like do no harm kind of thing where if someone is already self-medicating, like if they're purchasing gray or black market hormones, and they come to the doctor and say, I've been doing this and I would like to get a real prescription now. Like, at least, you know, Natalie Wynn, when she talked about it, she was like, I was already doing DIY hormones. And when I went to get official hormones, they basically just gave them to me because it is safer to give me the medication than it is for me to be buying it online. So the NHS is doing the opposite of that. They're like, if you're seeking the care privately or illicitly, then we might not ever give you gender-related care on the NHS. Go fuck yourselves, apparently. That's true. Most people don't speak dragon. That's special for you all. There is no mention of the substantive effect that forcing children to go through unwanted puberty will have, although the section on puberty blockers states that, quote, for transgender females, there is a benefit in stopping irreversible changes such as lower voice and facial hair. Other effects of not pausing puberty include trauma, stress of not fitting into social groups, unnecessary difficulties for trans women in particular fitting in, which obviously sometimes require additional surgeries. I do kind of wish that they were mentioned for trans men here. Like, if you grow breasts, you could have been put on puberty pausers and never grew breasts, but now you have to do a $10,000 surgery to get your breasts removed. Some surgeries, such as tracheal shave and Adam's apple reduction for trans women, are not covered by the NHS, meaning that the NHS is forcing trans girls to develop characteristics that it will then not help them remedy. So yeah, there's like lots of issues with this. There's a lot of concerns. There's a lot of assertions and a lot of like disregarding of evidence that is not preferable to them. Let me see what else I have on this. Make sure that I covered everything I meant to cover. Sometimes more than 10K. I know, I was just ballparking. Surgeries get more expensive over time as well. The fact there is no informed consent in the UK is part of the problem. Yeah, just wait for them to give you permission to take HRT. Might take a decade though. Yeah, like it's egregious in the UK system anyway that for adults, you have to tolerate a nurse asking you a bunch of really intense questions about how you masturbate in order to decide whether you get the medical care that you want. Like, and I'm sure that children get asked those questions too. Like teenagers, if they make it far enough in the process, it's like, what do you fantasize about when you masturbate? Like, you're disgusting. Like, the fact that that's part of the process is disgusting. And that's not an exaggeration either. Like, it is just part of the normal process of getting a gender dysphoria diagnosis that you have to reveal a bunch of personal information to some fucking cis person who doesn't know anything about being trans. Like, they don't go into the effects of, like, you know, what happens to trans kids who really need trans care, but who can't get it. I'd be a smartass and say your mom. True. Yeah, they're gonna call us groomers while they're, like, putting a person in a position of authority over you to then ask you invasive sexual questions. Yeah, people just die waiting for this healthcare. Like, there have already been suicides of people who are just, like, on an indefinite waiting list. And that's not a waiting list for a hormones prescription. That's on a waiting list for a first appointment. And then, they'll schedule you out for another appointment in 6 months, and then another appointment in 3 months. And then maybe they'll give you your goddamn healthcare. So you're on a 5-year waiting list, and then you get in, and they don't let you on the care immediately. They still make you answer a bunch of invasive questions and wait even longer. And then, you know, we want to, you have to live as your target gender for a period of time. So, okay, so you're expecting transgender women who have not had access to hormone therapy, basically looking like a man in a dress, to go socially live as their gender? Okay, well, are you giving them bathroom protections? Like, not really. One of the reasons for the long waiting list is because trans healthcare is understaffed. But you understand that that's a deliberate decision, right? Like, trans healthcare is being segregated because, again, if you're a cisgender woman and you're growing a mustache because you have PCOS, you can go and get testosterone blockers if you want them from your GP. Like, again, maybe you might get a referral to endocrinology because they need a blood test, but you can get that medication from your regular doctor. So you segregate out trans people and you send them, like, to a different healthcare, and then you remove, dude, there is noise in the background right now that's making me want to scream. Like, you keep those places understaffed. Like, there's no staff. So you can just be like, okay, well, whatever. You'll get the care in like 3 years. Like, okay, well, you didn't have to segregate me out in the first place. Why doesn't my GP just give me testosterone blockers if I want them as a trans person? Okay, let me check and see if there's anything else here. Yeah, they'd literally be saving money on a national healthcare system. The fewer clinics you have, hypothetically, the more money you would save. So you're paying the staff at a totally new clinic. You're paying for a brand new building to be built, or you're paying rent on a building, whatever. Like, you know, if I go to my doctor and I request, like, gender identity services, and then they refer me to someone else, like, okay, if that could have been done in one appointment, you've now wasted the time of 2 different doctors and had to pay them for that. Okay, let me see. Apparently there have been 4 inquests initiated over the last year for young trans people who died by suicide while waiting for gender dysphoria healthcare. So there are at least 4 inquests, at least 4 deaths that have resulted in an inquiry. Hey, Milena, what's up? We're just about finished with our segment on the CASS review. 118 likes. Yo! Later, Davini, have fun. Oh, West Coast time. So I don't have a lot else to add on this in particular. Like, it's insane the quality of evidence that's being permitted to dictate how trans people access healthcare and what we're allowed to do with our lives. Like, that literal social transition is being used as a scaremongering thing. It's so weird. I mean, it's not that weird. You know, the official position of the people running the NHS is that there should not be any trans people, and they just can't outright say that because it would be bad PR. So instead, they get to go, well, you know, the wait lists are so long, let's go ahead and do a review. Even on the adult healthcare, let's do a review of how we handle this healthcare. Did you talk about the Labor Party and how they are also fully behind all this anti-trans stuff? I haven't specifically gone into it, but that is kind of the impression that I'm getting, is that neither of the 2 main parties, because you guys basically, you have the Tories and then you have Labor. Like, that's your 2 big guys. You have more parties than just the 2, but those are your 2 big. And all of the Labor government is also against trans healthcare. You know, at least in America, we have Democrats who will pretend to be in favor of trans healthcare. It doesn't seem like you even have any politicians willing to pretend, or not many, not enough to make a difference. One of those inquests was of a 17-year-old trans boy in the UK last week. It's fucking heartbreaking. Like, I don't even know what to say about that. Like, obviously, if you have, like, the idea that healthcare is available, and then you keep dangling it, and like the person gets so close to reaching it and then you just like, oop, I'm gonna yank it further away now you have to keep walking to get close to the reward that you want. Yeah, of course people are gonna kill themselves. Like, how many times can you have the rug yanked out from under you before you're like, oh well, I give up? If you're 17 and you know that you're about to age off of the teens waiting list and you have to start all the way over with services that are projecting sometimes like 23-year long wait list depending on what province you live in, because the wait list is different depending on where you live, and you can only go to the gender identity clinic of where you live. Oh, and if you move to a new jurisdiction, you have to start over on their wait list. Thank you, Melina. Yeah, the Labor government's new motto is basically, we are exactly the same as the conservatives. They are ghouls. Tragic country. Yeah. Wild. It doesn't seem like it's going to get any better anytime soon. So that's why people are like refugees from the UK. And that's why people are leaving the UK to come to America. It's like, America is not much better, but at least we have places where you can get informed consent healthcare. Maybe you won't be able to get it in your particular state, but there are places here in the US where you can get informed consent healthcare. Thank you, my patrons, especially Tiago Nascimento, Mersh Rolvog, Amanda B., Michelle Frateroli, Wellington Marcus, Michelle Winter, Danielle McDonald, Suzanne Maynard, DZXN, Spooky Heather Sylvia, Ella V. Nobody, Pasnell Infinity, Jamie Jam, Sojo, Nova, Elizabeth Bartell, Athiet, Kevin Young, Desi Quiche, Celeste, Liam Hodgson, and Mr. Atheist.